This time we are going to use an economic concept such as information asymmetry to apply it in the health area. In general, the asymmetry of information speaks about the potential power of knowledge. For example, there is specific knowledge that can give us power over a situation or even over some people who simply don't have this knowledge. As you can see, this asymmetry is evaluated in a binary relationship, which in this case will be the professional relationship that exists between a doctor and its patient. Within this example, we will use a specific scenario consisting of the treatments for a patient's respective case. It's quite evident that there is an asymmetry of information because the doctor knows all the treatment options and all the implications of the disease, while the patient in most cases remains ignorant. I want to talk about some ways in which this can be a problem for us as patients. Health insurance companies. Out of ignorance, most people consider insurance companies to be the salvation of their problems by providing a good quality economic solution. The reality is that these insurance companies in most cases increase medical costs, which from a business point of view it makes a lot of sense since they have to profit on the margins. Besides that, an insurance company is an intermediary in the health system that for obvious reasons delays and complicates the medical protocols. As if that were not enough, the insurance companies manipulate the health system, including the health professionals. Something that usually happens in many countries is that doctors don't recommend the best treatment for the patient but rather the treatment that's inside of the health insurance's coverage. Hence, it's not the best medical service. Thanks to this asymmetry of information, most people are manipulated, and the worst thing is that these same people are grateful for a mediocre system. Internal policies. A health center like a hospital has its internal policies that are not necessarily focused around the well-being of the patient, but like any entity is focused on its integrity. It is completely normal, but most people ignore it, creating an information asymmetry that is reflected as a disadvantage. Simply put, most patients are naive enough to delegate responsibility to an entity whose priority is not to fail financially but to maintain a positive stream of income. Don't take it personally. It's just business. Medical bias. It doesn't matter how kind a doctor is. That nice doctor can also be biased and therefore have a penchant for certain treatments. Even their recommendations may be based on unreliable statistics or research that has conflicts of interest. It's alarming how many patients don't know the success rate of their recommended treatment. They don't know the reason behind each medical recommendation. They don't care to understand the medical protocols that affect them. Their only explanation for a medical decision tends to be, "The doctor told me." That shows great negligence on the patient's behalf, who should be more informed because at the end of the day it is about their health, which in the best scenario is about quality life but in the worst scenario is the difference between life and death. Pharmaceutical companies. This is an industry with a lot of controversies, but I will only say that these sponsor several clinical trials and research, which implies a conflict of interest. From a business perspective, it makes total sense, so it's not always the company fault. You should know that I'm not talking about bad companies or bad doctors necessarily. Indeed, they exist in every country. What I'm saying is that everyone has their own set of priorities and worries. Don't load them with a responsibility that is only yours. The message with all this is that you must be diligent with your health by acquiring the information that corresponds to your case. Don't be so easily manipulated by ignorance.